Hey everyone, welcome back to my channel. It's Dr. Alessandro. In this video, we're going to talk about a hot button topic that has come up recently, and that is fees at dental schools. So what's come up recently is that my alma mater has decided to start charging fees that are greater than private practice fees for basically all of their procedures. Also to start charging for procedures that really we in private practice don't even charge for. Now, I'm not sure what prompted this. I really don't know. It's very strange. And I don't know what prompted the dean to issue a memo to everybody saying that fees hadn't changed in 2 decades and needed to be changed. So, first of all, the fees have changed in the past 2 decades because I graduated in 2003. And I can tell you in 2001, for instance, crowns cost $180 and a simple filling could cost as little as $17. I was a student there. I knew the fees. So I can tell you all that. So fees have changed. They changed from $180 to $300 from 2001 to 2002. So there was an increase in that time. So I can tell you that it did happen. And then when I was a full-time faculty member from 2012 to 2015, crowns in the pre-doctoral clinic were at least $500. So they changed sometime in between those 2 periods as well. So the fees did change. So that's item 1. You can't go around writing a memo saying fees didn't change when in fact they did. Number 2, when you start charging $1,300 for a crown, which is what's being proposed at the dental school, you are far exceeding a lot of local private practices to the dental school, and you're exceeding, in fact, a lot of luxury private practices in general. My private practice doesn't even charge $1,300. So you're grossly overcharging for dental school treatment. That's going to have a number of negative impacts. First of all, it's going to alienate the local patient pool. Now, while the argument is that our patients, they'll qualify for a sliding fee scale and they're only going to pay the fees that basically according to how much they earn. Well, a lot of people might not understand that or might not sign up for that. Some people might sign up for it and might qualify, but I'm sure there's going to be administrative troubles. I'm sure that not everybody will qualify for the sliding fee scale. So some people are going to be stuck having to pay $1,300 for a crown. They're just going to go elsewhere. So there's going to be a loss of patients that way. So the school is going to lose out on revenue from some patients. The school is going to lose out on, actually more importantly, really not the school is going to lose out, but the students are going to lose out. The students are going to lose out on educational experience because they're going to have patients that leave. So some students aren't going to be able to complete their requirements on time. In fact, I'm going to say that it's going to be a larger and larger number as time goes on because people aren't going to want to pay private practice fees or greater fees when they can go to the local private practice and pay less and take a lot less time. Because let's face it, dental school is there, in theory, that's how it was when I was a student at least, to provide high quality care at a very, very affordable cost. And believe me, a $1,300 crown is not an affordable cost. Not at the dental school level at all, for any reason. So I feel that this is a big mistake by this dental school, which is my alma mater, and many others that are charging greater fees for their procedures. The whole idea of a dental school is for education. Education will take longer, so these students will take longer to complete what they need to do, and the appointments are a lot longer too. So it's always going to be a trade-off of time and money. So the patient who understands this, I imagine, is trading a lot of their time for a lot of money and cost, or that's how it should be in theory. But the way the model that's happening now is going, this model is moving along, it's not working that way anymore. And that's a shame. And in fact, in 2014, in March, at the Valley Forge Dental Conference outside of Philadelphia, Pennsylvania, a titan of the dental field named Gordon Christensen called out the dental schools and said, shame on the dental schools for charging these fees that approach private practice. Because dental school is an educational experience. It should not cost people a lot of money to get care at a dental school. Well, ladies and gentlemen, we've gotten to the point in 2021, just 7 years later, where dental schools are now charging fees that are in excess of private practice. They are way too large, and this shouldn't happen. So that said, I appreciate you joining me on this hot button video topic. I'm sure that students will weigh in on my video. I'm sure that maybe some educators will. And if some administrators, perhaps some associate deans or deans wish to talk with me about it, I welcome a discussion, because I want to know why the fees that are being charged to patients of dental schools are getting so outrageously high. I'll give one more example. A number of years ago, when I was director of the AHD clinic at Temple University, I had a great dentist, a guy who does crown and bridge work that's superb, Dr. Todd Fleischman. He was a year behind me in dental school. Smart guy, great provider. He was trying to refer to our clinic a patient who had a certain condition and needed a number of crowns done. But in private practice, it was really, really expensive. So I remember him asking me what the fees were for the AHD clinic. Now, I don't remember them specifically, but I know the fees were over $600 per crown. I'd like to say they were $650 or $700 at that time. And he said, well, that's not worth it. That's not worth the time and everything. That's expensive. And I had to agree with him. That it really had become really not all that much less expensive than private practice. So he ended up, I imagine, treating the case because, unfortunately, the trade-off of time versus money was not worthwhile. So that's where we are today, folks. And I'm really hoping that some people take this to heart and maybe dental schools kind of take an internal look at themselves and see how can we do better? Because this certainly isn't doing better. Charging people more than private practice isn't doing better. It's doing a disservice to your patients and to the students. So again, thank you for joining me, and I hope you're all staying well and healthy.